I still do medicine, but I do medicine on my own terms and I love it. It doesn't feel like work. It has really changed my life. I love taking care of the people I have met at the horse shows. I have a concierge medicine practice with like 50 clients. I've just developed all these sort of verticals within the business. Like today I was at a horse show and I rode my horse and I had my business going. It was like akin to leaving my books in the library where my nurse was in my office. I put on my riding clothes and for an hour I went and I rode my horse and it was fantastic.
Hey there! I'm so excited because today I have with me Dr. Barb Blasko, who is a physician that basically turned what is her interest, horses, into like a side gig, right? That now basically is her main gig, right? It's so fun to listen to. And that is what this channel is about. It's about showing you how, even as a physician, as a professional, as somebody with all the letters behind your name, you can effectively just enjoy life, enjoy your practice, craft your life the way you want it to be by simply thinking outside of the box. Outside the box, right? There are no boxes. So, this interview that I'm about to show you was actually one that was held during the Multiple Streams of Income Summit, Freedom Through Multiple Streams of Income Summit that we hosted on the Women Physicians for Multiple Streams of Income Facebook group. And if you're not in there, you should be. Okay, so just request to join. And this was so much fun. It was so enlightening. Those who attended loved it. Like they were like, oh my goodness, this just popped my mind open, right? So you're about to basically get a taste of that goodness. And after you watch this, be sure you go watch the others because he'll be in the channel as well. And make sure you invite a friend. All right. Let me get out of the way. Well, I won't be out of the way because I'll be interviewing her, right? But I want to let you watch it and I will see you on the other side. Hi there, Doc. How are you?
Great, thank you.
I'm so glad that you're on here tonight. Okay, so um guys, so Dr. Barb, the first time I actually met Dr. Barb, I didn't even realize that it was the same person. Okay. But her story caught my attention and it was that she has taken something that she loves and woven it with a skill that she has, which is her love for horses and her skill as a physician, and woven it into a business and income stream. Dr. Barb Blasko is a board certified emergency medicine physician who also happens to be a competitive equestrian. She's been riding horses all her life and has figured out a way to meld both her passion. People at horse shows found out that she was a doctor. They, of course, began asking her medical questions. She began providing advice to friends at horse shows and then started carrying out a knapsack that held her stethoscope and some basic medical gear. Over the last 4 years, she has now grown her knapsack medicine business into both mobile and office-based urgent cares at horse shows throughout California, Florida, and New York. Dr. Barb, thank you so much for joining us this evening. Can you just like introduce yourself and sort of like tell the people who you are, what you do, your backstory a little bit?
Sure. Thank you so much for having me. I guess I'm a little different than the other speakers, obviously, because I still do medicine, but I do medicine on my own terms and I love it and it doesn't feel like work and it has really changed my life. I mean, so it's kind of hard to explain. Obviously, if you don't ride horses, you don't know what goes on at a horse show, but a horse show is usually like a 5 day event, Wednesday through Sunday, where people come, they bring their horses, they stay either on the grounds in RVs or they stay in hotels. Competitive horse people are like nomads. They oftentimes don't spend a lot of time at home. They're
Mm.
on the road, they're traveling. And so it's I don't know, it's just it's a very different lifestyle.
Mm.
And it's different than other sports because the events are usually, 4 to 5 days long. It's not like a soccer game where you go and it's the weekend day. There are, events that last a long time. And then there's equestrian competitions where the can be in one place for 3 months. So you can have an event going on for 3 months. And during that 3 months of time, obviously, like different people come in and out. There's different competitors, so it's not usually the same people for the whole time.
Mm.
So they're definitely like long-term events where people spend a lot of time. Um, so I grew up riding horses. I actually kind of picked my medical school because it was close to the barn I rode at, so I could keep riding horses and still go to medical school and still keep riding. It's funny because I used to leave my books in the library and go ride horses and come back and study, and the books would still be there. And everyone thought I was crazy because I rode horses and would leave before a test. But mentally it kept me focused and it kept me able to focus on my studies because I had this outlet. So I initially, kept horses and medicine very separate. I didn't tell people at horse shows I was a doctor because I didn't want to be bothered. I didn't want people asking me medical questions because the minute you tell someone you're a doctor, they ask you 5 million things, and you're like, I just want to ride my horse or do whatever I'm doing, and I want to answer your dumb questions. So I just kept it quiet. And then gradually, people got to know me and they found out I was an emergency medicine doctor, so they knew I could answer a lot of questions. And slowly people started asking me for advice and I started telling people, basic things, not too much because I didn't have malpractice, I didn't have a way to like really document stuff. And gradually enough people started asking me these questions and I started thinking to myself, I think this might be like a real opportunity. I think this might be a real thing where people would really want my services. And people that ride horses tend to have, disposable income. They're fairly wealthy. A lot of times when people leave my office, I ask them if they're flying commercial or private. So a lot of them have planes. They have the wherewithal financially to pay for medical services. They want convenience, and they don't mind not using health insurance because I don't take insurance at my offices because it's just too much of a hassle.
Mm.
Um, so, enough people started asking me, if I would help them. And finally, I did some research. I put together a business plan. I looked at financials and I bought a mobile medical clinic that was drivable.
Mm.
And I kid you not, it arrived like the day COVID shut the world down. So I got my mobile clinic and like everything shut down.
Oh man.
And it was actually very fortuitous because it kind of allowed me to like take my business really slowly
Mm.
because finally, like I think COVID really started in California in March, like it really shut everything down. And then I think by May we were allowed to have some horse shows and allowed to have, people have events and stuff. And so I went to the first horse shows and it was a lot less people than I was used to, but I think it was good because it wasn't overwhelming. The services I was providing were pretty small at that time compared to what I do now.
Mm.
And I think it allowed me to just, start gradually and expand slowly
Mm.
versus being in a situation where I was trying to do everything all at once because I learned that definitely does not work.
Mm. Mm. Now, before this, what was your business background?
Um, okay, well, I started my first business when I was 14.
Okay.
I did. I started, of course, it involved horses. I started, my whole life revolves around horses, but it's just an amazing passion of mine. I started when I was 14. My mom bought me a horse, but one of the things was like I had to contribute to the horse financially because, to be honest with you, my parents had no reason like financially they should have invested in a horse for me. Like we didn't have the wherewithal to have a horse. I don't know what my mother was thinking, but anyway, she bought me a horse. And so I needed to figure out how to pay for some of the horse expenses. And one of the things that you do when horses compete is you put these little braids in their mane and their tail. And I learned how to do it because, I had to do it for my horse and I got really good at it. So that was actually my first business. And I have an invoice that I made that's hanging in my office at the horse show, because it reminds me of, where I started. So I guess that was my first business, and I made a ton of money.
Oh, wow.
It was all cash, people would pay me, and back then it was like I'm old, I'm 55, so it was in the 80s, and I was making 200-300 bucks on a weekend, and that was pretty good at the time.
Wow. 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 Now, the reason that I said, you know what, we have to have you on here was because you were able to kind of take something that you loved and put it together with your medical practice. Now, not everyone will be able to do that second piece, but it's being able to sort of leverage the piece that you love to turn it into a business. Now, one thing that I've seen sometimes is that for some people, when they do that, they end up getting lost in the business part that they don't enjoy that piece anymore. What has your experience been embracing the business side of things? Because that part has to be solid too, if it's going to stay a business.
Sure. So I guess I'll backtrack a little bit. Like, a lot of people ask me why I became a doctor and not a veterinarian, and it's not an equine veterinarian. And it's
Hmm.
exactly because of that, because
Okay.
every equine veterinarian I spoke to never rode their horse. They never had time. And so I didn't become an equine vet, and I loved medicine. I loved science, and I became a doctor. I also became an ER doctor because I like my time. I like my own time, and I didn't want to have, I don't want to be on call. I didn't want to have someone, calling me all night. I didn't want to have to go into the hospital. So that's why I became an emergency medicine doctor.
Mm.
And I think, I love taking care of the people I have met at the horse shows. I've developed amazing relationships. I have a concierge medicine practice with like 50 clients. I do weight loss. I do care coordination, sort of a patient advocacy role. I've just developed all these sort of verticals within the business. And like today, I was at a horse show and I rode my horse and I had my business going. And so it was like akin to leaving my books in the library, where my nurse was in my office. I put on my riding clothes, and for an hour I went and I rode my horse, and it was fantastic. And then
Wow.
I came back, and I actually stayed in my riding clothes and I saw patients, and you know, I did the rest of my day. I actually wanted to share a picture. I don't know if I can
Sure.
share. Can
Yeah.
I share a
Let me
screen?
see. Yeah. Ah.
I don't know. I don't know how well I shared this, but anyway, this is me. I have a permanent office building. I'm in Southern California, and I have a permanent office building out in Thermal, where there's horse shows for about 6 months out of the year. And there I was riding my horse, and I got back on, and someone had a fracture, so I had to just like leave on my riding clothes and just get the X-ray machine going. So I don't know. You can be a doctor in all kinds of clothes, even riding clothes.
I feel like if there's any picture that just like showcases this entire summit, it is this one picture.
This is it. And I didn't start like with an x-ray machine. I mean, that's a
Right.
$40,000 x-ray machine. It's a huge investment. Like, I remember when I first started and I had my mobile trailer, I thought 750 bucks was a lot to pay for an IV fluid warmer. I was like, oh my God, I don't have $750 to pay for this thing, because we do a lot of IV hydration and we'd like to keep the fluids warm. So anyway, and now I'm like, 400, $40,000 for an x-ray machine, no problem. But Um, but not only that, I actually had to get certified to do the X-rays, because in California, you're allowed to shoot X-rays as a physician, but you have to take this really hard test. I mean, it's one of the hardest tests I've ever taken in order to become a licensed uh, radiology, like, I don't know,
Heck.
not really a tech, but yeah, it allows me to do the X-rays. I could read the X-rays because I'm an ER doctor, like that was
Right.
no problem. But then I had to learn how to shoot the X-rays, so I had to hire an X-ray tech from my hospital to come out and like show me how to position everybody and show me what to do, and show me how to work the X-ray machine. But anyway, so now I do X-ray, and people love it because obviously falling off horses, you can break bones.
Mhm.
And they're very happy to have the X-ray very conveniently located, and they don't have to leave. So anyway, that's me doing an X-ray in my riding clothes.
No, thank you for showing that. Thank you for
Uh,
showing that. Like I feel like everybody, I feel like that was just the perfect visual for this point in the summit. Now, um, if someone were thinking of branching out into something that may be considered non-traditional, are there any tips or words of advice that you will give them from the experience that you now have having launched your I guess equestrian related medical practice?
Yeah, I know this is like a crazy thing. I don't have to work in the ER anymore. I started out and, my first year in business, I think I made like, $10,000. I did make a profit. I still worked in the ER. Um, I have financed nothing in this business, except my initial trailer that's now paid off. Everything I purchase now, I buy in cash.
Gosh.
So I don't have any debt on the company. I'm looking to do hopefully this year, my first million. I was pretty close last year. And this is with me and my office manager. Like we're a two-woman team. Like we don't have a bunch of people. I have nurses that work for me. We don't have a bunch of people that are in the background. It's me and her. But I have to give a lot of credit to Dr. Una, who was on here on Monday. I am in the EntreMD Business School. It's been a huge investment, like just within myself and my business. It's helped me to basically quadruple my revenue. And I think anybody that's interested in becoming an entrepreneur just should podcast, the EntreMD podcast, and then I can add it to the chat. But I think that's a great place to start if you don't really know what you want to do. Um, and I also think that finding something in your life that you love and figuring out if you can combine it with medicine is just amazing. It is really amazing. And it has not taken any of my passion away for riding horses. I mean, it's just made it even better actually, because I can work and ride horses all at the same time.
Amazing, amazing. Thank you so much for sharing that, Dr. Barb. Now, if people have to want to reach out to you, how can they find you?
Um, I don't have any great resources. I don't have any books. I don't really have any free courses.
You just came as an amazing vision board. That's it. It's not.
I don't. I am actually doing a franchise this year. I've been working with a franchise attorney. Believe it or not, horse shows are so prevalent around the country that I have had so many people ask me, could we have you at the show? Could we do this? I've also turned down so much investment from huge companies that want to invest. I have just said no to everybody because I don't want to be told what to do by anybody. So no investors, but pretty much if someone wants to find me or reach out to me, I'll put my email. I do have a franchise list going because I've had about 8 or 9 different physicians reach out to me in terms of doing a franchise. And like you don't have to know much about horses to get this going. Like you can learn on the fly.
Hmm.
Um, so anyway, my website is showmd.org, and there's a contact us page, and we've got a Facebook link, and I can put my email on there. But definitely, I think for anybody who's thinking about becoming an entrepreneur, I have learned so much from Dr. Una, so I just have to give her a lot of credit.
Amazing, amazing, amazing. Thank you so much for coming on this evening, Dr. Barb. Wasn't that good? I told you it was going to be good. I told you it was going to be good. Okay, Dr. Barb Blasko, you want to check out her resources down below. You can check out the description and check out any of our other resources down there. We've got courses and connections. Like you want to be in our world, just trust me. You want to be in our world, okay? If you're a physician or a professional who is thinking about generating income outside of your main practice, you definitely want to be in our world because we know the people and we have the hookups. I'm just saying. I'm just saying. Anyway, I will see you on the next video. Take care, guys.